Good afternoon. I'm Lisa Strazzanti, Senior Project Lead at Open Minds, and welcome to today's discussion, Learn How C-Suite Leaders Transformed Revenue, Productivity, and Staff Morale through Innovations in Clinical Documentation. Today's executive web briefing is brought to you by Open Minds and sponsored by Remarkable Health, which offers CT1, a fully integrated EHR, and this year they launched BELLS, the first virtual clinical documentation assistant for agencies serving the Medicaid population. Today, we are joined by Monica Oss, CEO of Open Minds, and from the Mental Health Association of South Central Kansas, we have Mary Jones, President and Chief Executive Officer, as well as Bailey Blair, the Clinical Liaison. Dale Hamilton, who is the Executive Director of Community Health, will be along with his colleague, Leslie Lenig, Regional Manager for the Southern Region for Community Health and Counseling Services of Maine. And that rounds out our panel for today. During our time together, we'll discuss the use of enhanced clinical documentation processes to increase productivity and reduce risk around audit recoupments. You may notice that all attendees have been muted for today's presentation, but we are recording today's event and muting the phone lines assures the highest quality of sound. However, we do encourage you to submit questions via the question box on the GoToWebinar panel at any time throughout the presentation. And at the end of our discussion, we'll hold a brief question and answer session. So without further ado, I'll turn the floor over to Monica.
Thank you, Lisa, and welcome to our audience. I'm pleased to be here today to really talk about this important topic. First, to get started, I do want to thank Remarkable Health for their sponsorship of the session today. For those of you who don't know, in 2014, Peter Flick, the CEO of Remarkable, created a vehicle to pursue the concept of Remarkable Health. And in 2015, actually acquired ClaimTrack, an EHR software pioneer in the behavioral health space. Post-acquisition, the company launched their enhanced fully integrated EHR. And this year, they launched BELLS, which is the first virtual clinical documentation assistant for the field. So their contributions to this discussion are many. We have a great panel today, and I'm in a minute going to ask Dale Hamilton, Leslie Lenig, Mary Jones, and Bailey Blair to introduce themselves. But first, I want to talk a bit about sort of our objectives for today. There are really four things we want to be sure we cover. One is to understand the role of clinical documentation in competitive advantage in the current market for provider organizations. We want to take a look at some of the current performance metrics in the clinical documentation space, learn how tech-enabled solutions can help to improve performance around clinical documentation in both time and quality, and then hear how enhancing clinical documentation processes can actually improve productivity and staff morale, as well as reducing the risks around audit. I'd like to first start by just taking my hat off to a great panel, and first ask Dale and Leslie if you could introduce yourself and Community Health and Counseling.
Sure. So I'm Dale Hamilton, the Executive Director of Community Health and Counseling Services. We've been around since 1883. We serve all but 2 counties in the state of Maine with a variety of services. Our services include home health, hospice. We have a private duty nursing company. We have limited primary care, and we provide comprehensive behavioral health services. And I'll turn it over to Leslie.
Great.
Hi, I'm Leslie Lenig. I have worked for Community Health and Counseling Services for over 10 years, and I'm the regional manager for the southern region of our catchment, which is most of the state of Maine, as well as taking on some of the clinical lead responsibilities for the agency.
Thank you both. And then I want to turn to Mary Jones and Bailey Blair. Mary, if you could start, you can maybe introduce us to MHA of South Central Kansas and yourself and your team members.
Yeah, absolutely. Thank you very much. MHA is a nonprofit organization. We've been serving South Central Kansas since 1957. We are an affiliate of MHA National. who many of your organizations may be familiar with. Our organization is prevention, education, and treatment. So we also provide community mental health care, and we do offer a wide range of services. The majority all include clinical or direct services to people with mental health needs. I myself am a licensed clinician. I've been in administrative roles for over 25 years in the behavioral health field. Bailey.
Thank you. My name is Bailey Blair. I am the clinical liaison for the Mental Health Association. I provide clinical oversight for the community services, adult case management, peer support, etc., as well as provide intake assessments and ease transitions for those coming in and out of inpatient care, higher levels of care in the justice system.
Well, great. Well, I'm looking forward to getting started. And before we do, I just wanted to take a couple minutes to set the stage for why this topic is so incredibly important. It has been a very trying last year and a half for the country, but certainly for health and human service providers in particular. And one of the big challenges as we look ahead to 2022 is really the challenge for provider organizations to map out that strategy for sustainability and success. And as we all know, it involves every organization doing something new in terms of partnerships, services, new populations, and new technology, all with a focus on both improving performance and reducing cost. That is why technology in general, and we're going to talk about technology in specific, that's why technology is such an important ingredient of strategic success. I like to think that technology for most provider organizations is really about 6 key things that are part of that strategic success formula. Certainly one is better data and more accurate data, and we're going to be talking about that today. Improving administrative and clinical efficiencies, enhancing consumer outcomes, getting a better consumer and professional experience to get us closer to the quadruple aim, facilitating participation in value-based reimbursement, and speeding organizational growth. All of clinical documentation, while a segment of organizational operations, touches on each of these key issues. And just to give the audience a little bit of a flavor of why clinical documentation is so important, on average, 40% of staff member time is spent on clinical documentation. It usually takes, and these are obviously national averages, 3+ days from the time of a session to the time of final note signing. And I think on top of all that time and expense, what we find is that between 15% and almost half of clinical documents are missing or some information or have erroneous information. What hospital executives have learned is that focusing on quality improvements with clinical documentation results in great savings. And we want to talk today about how that translates into the behavioral health environment. There are a lot of opportunities if you're a manager in an organization where clinical documentation is an issue. There are a lot of opportunities for innovation. You can analyze workflows, you can tie documentation into outcomes, you can invest more in training to support that, the documentation process. Certainly offering incentives to staff based on the efficiency with documentation and upgrading technology are all parts of that, I would call, framework for improving both the efficiency and the quality of clinical documentation. And some of the performance gains we've seen by organizations who have embarked on this path is reducing clinical documentation time, often by half, cutting the time from session signing by a day, decreasing the time from start to finish in terms of clinical documentation, improving on the problematic late note submission, and improving in staff morale and turnover, and having the ability to create a new culture, mentoring clinical professionals in real time, and streamlined claim submission. So now I want to pivot to the real stars of our show today, our 4 executives who have actually taken the leap and are using technology to leverage that clinical documentation process. Now, before we do, I want to ask everyone in the audience to participate in a short poll, and that is which of the areas listed below would be critically important in improving the financial stability of your organization? Is it filling all your open positions with A players? Is it, cutting annual staff turnover by 50%? Is it billing for services the same day that they're provided? Or all of the above or none of the above? And we'll give everyone a chance to give us their response to this critical question.
The results are in, Monica. I don't know if you can see them, but it is 67% said all of the above, 22% said cut annual staff turnover. Then we have 7% saying bill for services the same day services are provided, and 4% saying fill all open positions with A players.
Well, thank you, and thank the audience for participating. I think it points to, it's interesting to me that we had 60% say that all 3 of those issues are important, and a large proportion talking about cutting staff turnover. But in a time when recruiting is so important, that the results aren't surprising. I think they just reinforce the importance of the topic. Now, to get us started, I'd like to, turn our first question to Dale and ask you, what are the challenges that led you and the team at Community Health and Counseling Services to deploy artificial intelligence technology in your clinical documentation process? I'm hoping you can talk a little bit about what led up to that decision.
Sure. I think there are 4 areas that we looked at where we saw the advantage for using AI, and the first is the ease of completing documentation. That is such a critical piece in terms of our staff going to complete the documentation in the way that you would like if it's not easy to do. And given the community-based nature of our services, we're out in the field, we're not sitting behind a desk. That easiness of access is related to the ability to connect, having connectivity. And so using AI to establish that process was important. Timeliness of documentation. If it's not easy to use, then it tends to be put off, which means that individuals in the field are not documenting concurrently because they either can't access the product or it's just too complex in the moment to do so. So that timeliness gets delayed, gets pushed out, and every note that's delayed when you have multiple notes for multiple visits and appointments ends up pushing documentation out. And we know the timeliness has an impact both in terms of the next part, which is quality, but also in terms of revenue. The quality piece is certainly a component that we looked at. Quality really is dependent upon those other factors. If it's easy to use, the quality of the note is easier to write. Also, if there's a standardization in terms of the note that's prompting individuals to document so that the key pieces of information are consistently captured, that enhances the quality. And so that's something that we certainly looked at internally, that we know that documentation and the quality of documentation can vary greatly because of the access and the timeliness. And then another piece is the duplication, reducing duplication. When you don't have the ability to use the electronic system immediately to capture notes, what tends to happen is individuals take hand notes. I'll use our crisis services as a good example, where they drop to paper and they're capturing all this information on paper. That results in either one of 2 things. One is either it's going to be scanned into the document as a static document, which takes a lot of staff time to just do that function, or it's going to be done again. It's going to be typed into the clinical, so you're duplicating efforts. So those 4 areas were problems that we knew were areas we wanted to address, and AI presented a solution for that and has proven itself to address those areas.
Well, of those, Dale, that's really fascinating. Of those, the ease of documentation, timeliness, the quality of the note, the reduction of duplication, can you share, what have you found as the benefits now that you're kind of knee deep in this? What have been the changes you've seen in the organization?
Well, I think as far as all of those points, what it's allowed is immediate access. Because we do not have to have connectivity to access the note. We can capture the note, and when we complete a note in the field by using AI, it automatically puts that into the electronic system. So there is no duplication. There's no need for staff to go back and do anything else. It takes that information and it moves it forward. It helps us in terms of the devices that we use in the field, of being able to move to a system where it's streamlined, again, using our mobile crisis outreach. Currently, they're carrying large laptops. We're going to be able to transition to smaller devices so that they can capture the information. The templating that's available with the AI in terms of structuring the note, as I said earlier, to capture specific information. All of that has allowed the reduction of the time it takes for staff to do their work. They don't have to go back and redo it. And even when they're not doing it concurrently, they can capture critical pieces of information that they don't want to lose and have that available. So when they go in to write the note, that information is there for them. It's in one place. They don't have, they're not lugging around paper. It really just streamlines the whole process. And one of the things I would kind of compare it to is, I mentioned earlier that we provide home care services. We wouldn't think twice about not capturing important information around a patient's needs concurrently. But in our sector, we tend not to do that.
Now, anyone else have any comments about the 4 elements that Dale mentioned, or some of the effects that he's seen? Well, let's do this. I want to turn to Mary and ask you a question about one of those 4 elements, and that's the quality side of things. How has the AI-enabled clinical documentation affected quality in your organization?
Yeah, that's a fantastic question. And I would agree in all those points Dale said. Quality is extremely important in an organization like ours. I come from a compliance background too, and one of my roles in the organization previously. And so understanding how that quality of documentation feeds revenue and keeps risk factors low is really important. What we've seen is using AI enables some certain language or prompts for staff to be able to go ahead and say, oh, this is a better choice, or this is a way that I can write the note. And, the staff know what they're doing, and this provides a vehicle in which we can capture what they're doing in a better way. So having some of that ability really helps the staff focus on what they are good at and what they need to do, and allows us then to capture that in documentation. I would also say the piece of time that was mentioned earlier, Monica, is that we all know logically we can say, if I write something down sooner to the moment it happens, I'm going to capture more of the information in a more comprehensive way. And having a tool that is just ready to go, that someone can have a quick access to, jotting down notes or writing down some thoughts or putting some pieces down, so they can do it in the moment and it isn't a chore that they come back to later. We've really seen that as an effective measure. I can write it now and feel good about what I've done, and it's more comprehensive in nature. The other piece I think we're striving for all the time is good medical necessity. For those of us in the field, the golden thread, from intake to treatment planning to progress noting, this is what we're striving for. And using AI-enabled technology allows us to thread that just a little bit better and take some of the human error out of that, being able to really revert it back to what are the treatment goals, what are the types of things that I'm doing in this particular service, is very helpful to an organization.
Well, it's funny as you pivoted your comments to the medical necessity piece. I was thinking about, how you see your investment in AI and the improvement in quality, kind of improving both your ability to work with health plans, but also your ability to participate in value-based reimbursement. Could you talk a little bit about that?
Yeah, we've had an opportunity to do some value-based reimbursement, specialized contracting, and prior to having AI-enabled technology, it was more difficult. There was a lot more paper and pen outcome driving, trying to figure out how we can pull reports from some other data set in order to demonstrate the value of the care. Having this type of tool allows us to be able to have data points that we can pull from. Or, I use the example of clinicians or staff members, their focus is not value-based care, outcome-oriented care. Their focus is, what am I doing in this moment with the person I'm serving to make sure they get the best intervention at this time? And so, the rub there is what the direct care staff need to be doing and what the administrators are valuing so that we can engage in these contracts and prove the efficacy of our services.
Well, I want to shift our discussion a little bit and to one thing about the whole concept of timeliness and real-time documentation. And I was hoping, Leslie, maybe you could talk a little bit about, what does that look like in the field? Because I think we have a lot of people listening today who would be saying, this sounds very interesting, but I'm trying to envision how the real-time documentation process actually works.
Absolutely, Monica. I think, the use of this AI, I'm going to echo what Dale and Mary have both said. I mean, it allows for that concurrent documentation that just simply cannot happen out in the field. If I'm going to somebody's house, I am not going to plug in my laptop and try to connect to their Wi-Fi to try to be able to document at the moment that I'm sitting with them. And so I, traditionally have defaulted to the notebook and done handwriting. And then when I get to the computer to be able to put the progress note in is when I'll get there. And so this allows in a very simple way to be able to do those notes, do my shorthand still, be able to do that, know that that's not going into the clinical record, so I can still write the way that I want to write. And it's texting, which a lot of people are used to, and being able to put that information in and even start my notes so that when I get at the end of the day, I can go and sit down at my computer for, I have lots of staff who say I sit down the last 20 minutes of the day. I have all my notes lined up, and I can just quickly put them into the progress notes and sign them and be done. And so it allows for that timeliness as close to concurrent documentation, official concurrent documentation as possible. I also, that duplication and reduction of kind of that duplication, I'm not doing it twice. I don't have to write the same note twice. The pieces that I take out in the field are easily transferable, so I don't have to write things over and over, which just helps staff feel better about everything that they're writing. It keeps the golden thread focus that's in there. And it certainly has decreased that risk for any kind of HIPAA confidentiality breaches, because if I'm writing in a notebook and I leave that at the house, that could be an issue. And so as long as this is on my device that I have with me, and it's HIPAA protected and password protected, so it's also helped us reduce any of those kind of risks that might have been associated with confidentiality or HIPAA breaches.
Well, it sounds like, Leslie, if I can just do one follow-up, it sounds like with this system, then the speed to documentation, the reduction in duplication is just as possible for field-based or home-based staff as it is for those working in office. Would that be a correct conclusion?
Absolutely. I think 100% that's accurate. And I've heard from staff that it actually has reduced their time with documentation more than 50%, because it's not, the redundancy isn't there, and that they are able to just capture what they need to in that moment. And even people who have been a little resistant to concurrent documentation for whatever reason have embraced this.
Well, it makes me want to, I'm going to move on. You know, your last sentence is, you know, kind of talking about staff who are resistant to you know, kind of real-time documentation. And I want to ask Bailey a question. You know, we've seen a lot of resistance to clinical team members adopting different types of technology. You know, EHRs weren't embraced by clinical staff with open arms necessarily. You know, Bailey, maybe you could talk a little bit about the reaction of your clinical team to using, you know, tech-enabled clinical documentation. You know, what was it at the beginning? What is it now? You know, I think our audience would like to kind of hear what the process was like.
Absolutely. I was hesitant at first. I know my staff pretty well, and I thought that we would have quite a bit of that resistance that you mentioned. And what I have seen is, you know, the people that I thought we would have the toughest time with have latched onto this and have ran with it because, like Mary said, it's a way to show how well they're really doing their work. And when we make things easier for them, they don't have to talk to us about productivity and documentation. They know they're out there doing their jobs. And I think that's what they saw here. And they have all, to a person, really grabbed onto this. And it's been exciting.
Well, you know, how long, if we could talk a little bit about kind of the effects of this. First of all, how long did it take clinical team members to kind of get up to speed? You know, how has this positively or negatively affected staff morale? You know, have you seen tangible effects of kind of this new tool in terms of their actual work?
We absolutely have. One of the folks that I alluded to earlier, I believe I taught her how to send an email when she signed on with us 2 years ago. And today she told me, you know, all of those things that you taught me about documentation, they make sense when I do it here because I can tell where things go. I have a template that shows me where to put the work that I've done. And so without additional coaching, our folks are getting better at documentation. The system is teaching them how to do that. As far as getting folks up and running, it has truly revolutionized our ability to do that. We used to see 2 to 3 weeks before a person could even write a note in our EHR, which means 2 to 3 weeks before they can bill for anything. I had someone billing in 2 days last week because the AI provides enough structure and those clinical drop-ins that no matter where they came from, they're able to document the work they did in the field that day.
Well, I can imagine that you know, that sense of accomplishment is very important in this era when people are burned out from the pandemic. I mean, have you seen any effects on retention, on competing for new employees?
Absolutely. I work a little bit with the area universities to sponsor their students. And it's been incredible to go out to them and say, you know, you hear all the time that documentation is the worst part of our job. Well, we have eliminated the worst part of documentation. So come work for us. And in regards to retention, the thing that spoke most strongly to my employees was the fact that someone was investing in them. There are a lot of ways that people could make more money than being a case manager, but they want to be a case manager. And the fact that people are noticing this and investing in the work that they're doing, trying to make their lives easier, that was an incredible gift that Mary gave to our employees. It's a horrible environment out there right now. We don't have much we can show our appreciation with, and this has been huge.
Well, let me pivot from that and ask Leslie a question about one group of team members, and that is clinical supervisors. So the question I have is I'm trying to think about how this process, the new era of clinical documentation works, is, you know, how has supervision changed? And do clinical supervisors like the new process or not?
Yes, I maybe some of my happiest staff, actually, I think might be the clinical supervisors, because of they can now focus on the clinical. They can now focus on the treatment planning and not have to spend the session teaching the mechanics of a progress note, or, even fixing progress notes that have been submitted that need to be voided and pulled back out. They're able to sit there and get into the nitty gritty. They're able to sit there and talk to people about different approaches that they could try with them, which makes everybody feel, that's why we all got into this field, is we want to help people. We want to dive into that, not to do the documentation. So it's taking less and less amount of time in the supervision, which makes everybody happy. The staff, the direct care staff aren't sitting there kind of rolling their eyes at just another conversation of a list of quality assurance stuff that we have to check off the box. Now they can actually get psyched and revigorated about their work with these clients. They're definitely some of the happiest ones.
Well, a couple related questions, because now you've got my wheels turning. So it sounds like what you're saying is the clinical supervisors can spend less time on the administrative part of their job and more time on the substantial issues around care management. I mean, how do the clinical supervisors interact with the system to make that happen?
So there's some reports and pieces that are much easier to be able to get a grip on where your staff is in terms of notes and being up to date. There's, built-in mechanics within the AI that you can't submit your note without having all the required components. And that's speaking exactly to what Bailey was talking about. That training piece is so much less now because you can't move forward with it unless you have the pieces that are there. So I think that's the piece that, as a clinical supervisor, I was for years, that was the hardest part of my job, was being the administrative supervisor as well. But it's often a dual role. But I like training people in clinical issues. And that's how I find most clinical supervisors are, that's what they want to spend time with, not the conversations about productivity and paperwork.
Okay. I don't know any of us like to talk about paperwork, that's for sure. Well, let me follow up on something you said and turn back to Bailey with a question. So kind of pre and post using an AI system for clinical documentation, can you talk about both training and onboarding? I know you referenced this, but how long did training take before? How long does it take now? And the same thing with onboarding processes. Kind of how has that changed? And maybe you can give our audience some idea of the kind of change in metrics for doing those two things.
Absolutely. One of the biggest changes that we've had really comes in our ability to recruit and onboard on a global level. We spent a lot of time looking for people who could run an EHR and who could document the way we needed it to, rather than looking for the best people that are face-to-face with the people we serve. And now we know we can train anybody to write a good note. Let's get those A players in every single position, because we can work on documentation later. So when we're able to really open up our hiring field to those that may not have extensive computer use history or may not have a clinical background that goes along with an EHR, when we show them you can still capture that work, and when we show supervisors that they can just turn folks loose, it has really opened our eyes in recruitment to the different kinds of people that we can employ. The training and ramp up process used to be about 3 weeks, with the training for documentation in our EHR being at least a week of it. Sitting down to, I would think any EHR is overwhelming the first time, but then hearing everything that comes at you as you're onboarding, learning your role and trying to feel confident and competent when you can't find a client chart, it's difficult. With this, there are so many pieces of the EHR our field staff don't need in their hands right away. Like Leslie said, they can focus in on the treatment plan, on the goals they're working on, and on capturing what they saw in the session and what the consumer saw in the session. And then we can come back and work into the EHR as we're able, as things start to make sense. And we have sessions on which we can coach their actual clinical work.
So it sounds like, if I can just make sure I heard you correctly, it sounds like with using a different tech-enabled documentation process, it actually opens up your recruiting process to a broader set of candidates. Would that be a fair conclusion?
Absolutely. We're no longer focused quite as much in the recruitment and interviewing process on that, could you possibly meet our 24-hour note turnaround? Now it's assumed that we can coach you up to that because the system is going to do a lot of the work for us. Now we're looking for people with those clinical people skills, the ability to relate, knowing that I've got a template, I've got a system that can help them represent that work in the way that will gain us recoupment.
Well, that's a big advantage right now when you think about all the how the scarcity of finding staff. To have a bigger pool to draw from really is a critical advantage.
Absolutely.
Well, I want to go back to Dale, and as I've been thinking about the discussion and the whole kind of use of the AI documentation, at the beginning of our session today, you spoke about a kind of mobile crisis and home-based services. How do you see, how is the clinical documentation process with AI different in those mobile environments? How has it changed how you operate your mobile services? Could you talk a little bit about that for the audience?
Sure. I think and I'll echo what's been said, is it focuses the work back on the clinical. And because the documentation really does take care of itself. The ability to do it real time concurrently with a template, with that guidance, with certain phrases and words pre-populated, it changes that dynamic. The clinicians aren't spending time trying to, oh, did I capture this? What am I supposed to have to meet this regulation? That note is used for the benefit of the clinical needs of the person we're serving, but it's also viewed by licensing to determine whether we're in compliance with licensing or accreditation. Also viewed by our funders, and did we include the right pieces? All of those things, when you talk about training up and having staff being able to do that, they're constantly thinking, am I capturing it, am I capturing it? Rather than focusing on the work. So the change process is really the value that AI brings to the clinical care, because it relieves the pressure around the documentation. And that is something that I can't stress enough. That is really the value of this product, is being able to move the focus away from administrative and back to clinical.
Well, if I could come back to also another comment you made at the start of our session, and that was a new AI kind of driven documentation process is going to allow you to change the equipment that people are using in the field. Could you talk a little bit about, kind of what that is, kind of budget impact on staff? Because I think that's a piece I don't want to have people lose as they come away from this discussion.
Sure. For us, it's being able to get away from the laptops and especially in this environment, trying to acquire laptops, it's very difficult anyway, but they're more expensive. So being able to drop to a tablet, to an iPad, to something that's streamlined, easy to carry, that changes it for staff. And that is one of the things that we hear consistently, is just the bulkiness of it. It's too heavy, and it really is. It's what Leslie referred to as, you're going to somebody's home and you say, oh, can I plug in? I need to connect to your Wi-Fi, and you spend 10 minutes trying to coordinate that activity, and that whole time you're losing the engagement, you're losing the clinical focus. It changes the dynamic. So being able to have a device that's easy to carry, that's not intrusive, and you're able to get right into it, whether you're connected or not, it changes just that whole interaction. It allows for the concurrent documentation without jeopardizing any aspect of that clinical care.
Yeah, that's a big change for the in the field staff. So that really is important. You know, as we look ahead, Mary, maybe I could call on you to talk a little bit bigger picture. You know, as you're looking at your technology investments, as you look ahead for the next couple of years, you know, what advice do you have for some of the folks listening in terms of prioritizing different types of tech investments? Where does you know, kind of clinical documentation technology fall into that? You know, kind of continuum of things you invest in? How does that connect with the EHR? You know, how are you doing your planning, and what advice do you have?
Yeah, it made me reflect back into we adopted an EHR in 2008, and what a challenge that was. And so, I think my vision is that we have to stay ahead of what's happening in the field. And unfortunately, behavioral health in particular has been a slow adopter to change. Clinicians have been, you referenced this earlier, not hesitant to get into electronic and tech things. There's worry about HIPAA and are you doing the right thing? So I think it's important for us, our organization and our strategic leadership to be thinking what's coming next. In order for us as an organization to stay competitive, you have to look at that. In our position, we have to be competitive behavioral health agencies, not just in terms of revenue and finance, but also in order to incorporate all the practices that we need to have in our organizations. Using technology is a strategy to get on top of that before it sort of gets in the way. And I think that's, you mentioned value-based care, you think about contracts with payers. It's all important that you're able to demonstrate the effectiveness of your services. And so technology is a vehicle to do that. And if we just sort of step back even outside of the behavioral health field, we recognize the shift and change in technology that's happened in the last 10 years even. And so looking ahead of that versus being sort of on the back end is, I think, incumbent across for all of us. Just a small comment I would make, as people have talked about at the staff level, what's great about AI enhanced technology is that the staff are used to working with apps and texting and those sort of formats, and so it's easily adopted by them because it's on their phone and they're used to that. So it's been an advantage as well.
Well, if I could, staying with the big picture, Mary,
Sure.
If you look ahead, what do you see as, and this is really beyond clinical documentation, but what do you see as your big tech challenges over the next couple of years?
Well, I mean, certainly, as was mentioned, the actual hardware is a tech challenge. Again, particularly in behavioral health, where that's organizations we want to save our pennies and be mindful about the types of technology hardware that we're using. The biggest challenge I think we have is understanding that technology is the mechanism by which we provide service. And because we've been such slow adopters, there's this change process that has to occur in thinking that technology is a separate investment from creating the services that we know we can provide. You really have to look at it as one and the same. We wouldn't imagine doing work now without a phone, right? I mean, it's that simple technology. We have to be looking ahead at what we need to provide our staff and what's going to be the easiest, most accessible tool by which we can provide service.
Well, Dale, I'd like to pivot and ask you the same question. As you look ahead at tech investments in general and more investments in, kind of clinical workflow, what's on the drawing board for you? Kind of what advice do you have for, C-suite folks who are doing this planning right now? Oh, I don't know. Maybe we lost Dale.
I'm sorry about that.
That's all right.
I would say that it's the technology is the value that we can add to the work to be able to focus on the work, and that's really the piece of what I think is so important is sometimes if you just look at it from the how much it costs to acquire a certain piece of technology, that's the barrier that we've had in this industry, because we are always looking at how do we make our dollars go further, and we have those competing interests. But the lack of investment in technology, which will add value, which will do all of those things that we've been talking about, staff retention, having that work-life balance for our staff so that they can focus on the work and not be going home at night writing notes or sitting in an office for several hours after their day is ended trying to write those notes. Technology is a path forward, and what we have to do is look at different ways to leverage the technology to be more efficient, to make the environment more user-friendly, and ultimately to improve the care that we're delivering and the outcomes for the people we're serving.
Well, it seems, I know there's a certain, I would say a lot of times when you talk about clinical documentation and the quality of clinical documentation, a lot of times there's not a connection of improving that function to competitive advantage. But Dale and Mary, for both of you, I'm taking away from this that improving those clinical processes you both see as very tied to your strategic advantage going forward. Would that be a fair summary?
Absolutely. It's tied to our financial health. It's tied to recruitment, retention, staff morale. Any key factor we have as an organization, technology is part of it.
And Dale, you as well?
Absolutely. And you can use one example as any kind of audit from any of our funders. Even a small recoupment amounts in a payback of significant dollars that prevents us from investing that back into our workforce and into our service delivery. And an AI platform, we can continually adjust that so that the required information is put in there, which really lessens the outcome of having a poor audit. So this is something that has dividends in many areas.
Well, thanks. I want to pivot. I know I've been asking all the questions, and I see we have a few questions coming in from the audience, and one of them I thought was very interesting. With all the reduced amount of time your team spends on documentation, what are they doing with the rest of their time? So feel free to jump in, any of the four of you.
Mine are seeing more people. I know that I always save my documentation for the very last minute, and I could usually squeeze in at least one more assessment or one more consumer at the end of the day if I wasn't harboring all those notes to do. And that's really proven true, at least for me, and I know several of the folks that I'm working with. We're also capturing more notes in general based on their ease of documenting those 5 to 15-minute phone calls that we need to capture, but it was so inefficient to do so. So I think we're seeing the ability to have more activity, more billable activity, and actually get more folks into our programs.
The other three of you, any similar experiences or anything you'd like to add?
I'm going to echo what Bailey said. We have staff spending more time with clients, picking up more clients, meeting kind of those productivity expectations. I think also I'm seeing them take care of themselves more, so that it creates happier staff. They're not staying in the office until 7:30 so that they're able to go home and spend time with their families. And so they're able to then come back to work and be rejuvenated, knowing that they don't have to do another 12-hour day the next day. So I think it's both. I think we're seeing more people, but it's also I'm having happier staff because of that. And then the only additional piece that I will add to that is that I am seeing more teamwork among everybody. We have a large treatment foster care program that has multiple players on it, and they can see each other's notes. And so we're having much more collaborative treatment being offered to clients, which is nice. Clients are also indicating.
Can you expand on that teamwork piece just a bit? Like, what are the different, in your case study example, who are the different people that see the notes, and how does that foster more collaboration and teamwork?
Absolutely. So on a typical treatment foster care team, we have a case manager, we have a skills coach, and we usually have a therapist. Sometimes we also have a med manager involved, and they can see each other's notes. And so we're seeing much more collaboration. Say the therapist is remarking on a child's need to decrease the social anxiety and be around kids more. So now the skills coach is able to notice that and being able to take them out into the community and also addressing that social anxiety. And so that golden thread is being upheld among team members. And the format that the AI includes is just so much easier to read through. You can see recent notes. You can be able to see what is being done on a very real time because people aren't behind in their notes. So you're generally able to see what happened yesterday, and that just makes a much more comprehensive treatment plan for people.
Does anyone else have I think that's really fascinating. It's an element that I sort of neglected in the questions I put together for today, but the whole issue of that data sharing across clinical, I wouldn't say silos, but kind of the various members of clinical teams. Anyone else have an example of how that might work in your organization or for a different program?
Yeah, I would say that, that fits nicely in terms of what we know is that the people we're serving sometimes cross over services in other areas, and they have a need to be seen by some other provider, and there might be primary care. It could be a crisis situation where they end up in an emergency department. Having access to real-time documentation is critical, and it's something that the larger industry is certainly moving towards in terms of being able to provide that in a timely manner. So having documentation that's if somebody needs to have access to that clinical data, we can retrieve it and we can provide it to that other entity too, and that just provides better continuity of care. And so being able to have better documentation improves the total quality of healthcare that's delivered to individuals.
Yeah, that ends up being a very big advantage as we move to environments that are really focused on integrated care and on value-based care. It seems to me that the metrics on both sides would really be improved. Well, I'm going to close. I know we're almost out of time with one final question for the group, and then another question from our audience, and that is for someone who has never thought about this before and applying AI to clinical documentation, can the two teams from each of you talk a little bit about what was that process like? How do you get started? How do you kind of introduce this to the team? What are the cultural challenges? What are the technical challenges? I know it was a question we haven't talked about, but I think it's an interesting question from our listeners.
One of the things that we found most important is to have champions. Get people excited about it. It was a request from our CEO and leader, Mary Jones, and we trained our supervisors to be excited to take this out and carry it, because I know that our employees look up to our supervisors. And if they're saying this is the way and look how exciting this is, let's stick with it, we're going to follow suit. And so we really saw that by maintaining that narrative and by championing this as a way that we're investing in ourselves and our workers, we kept that momentum going despite barriers that may have arisen.
I would just add on to that. Oh, sorry, go ahead.
Go ahead.
Well, I was just going to add on that it's also, this is an exciting tool for you, and incorporating the reasons why, that it's more than the documentation, which of course is important to organizations, getting the notes done, the revenue is important, but the self-care component, the work-life balance, for us, that's a message we've really tried to give our staff. We don't want you here till 7 o'clock, as Leslie referenced, doing notes. We want you going home to your families or doing what you need to do. to take care of yourself so you can be refreshed and energized. So I think building messages that support why you're going down this road, it isn't just another thing we're adding, it really has some value, and we believe in the long-term viability of these solutions.
So messaging and champions. Any other suggestions for organizations that haven't considered this before and might be thinking about it?
Yeah,
I can't. Go ahead, Dale.
Go ahead, Liz.
I was going to echo what Mary had said, in just the making sure that that message, that's been, our primary, that this is about helping you guys do your job more efficiently and effectively, and so that it doesn't become your life, and that you can have that home and work balance. I have found that that's where I've gotten the most buy-in, and absolutely having the people that are excited about it and the cheerleaders, and finding those right people within your organization, because they hear a lot. This is going to help with your documentation. This is going to be more efficient. And I did get a couple eye rolls when I first kind of put that out there, like, oh yeah, here's another one. But once they get into it and they see the excitement and they see the ease and real life application, I think that's where we got the buy-in and we started getting that momentum out there.
And I know, Dale, you were trying to jump in. Please go ahead.
I was just going to condense down something Bailey had said. I think a good AI product is very intuitive, and I think that the way to go into this is to really train the value while you teach the product. If you focus on just teaching the product, then you're just teaching another piece of equipment. But if you really go into it with the value that it's going to bring for all the ways that we've discussed, you're going to create the excitement, and you're going to get people to buy into it much faster than if they just think they're learning another piece of technology.
Now that is interesting. Now I see, Lisa, we have another question from the audience. Can you ask it for our panel?
Yes, thank you. We do have a few. The first one is, can the panelists share what AI platform they are using?
Yeah, we are using a product called Bells from Remarkable Health.
Thank you.
And Dale?
Same with us.
Okay.
Great.
Other questions, Lisa?
Yes, the next one is, has a collaborative documentation approach been considered with the extra time? For example, going over the notes with the client to get their input on the session and to make sure they know their goals at the end of each session.
Interesting.
Leslie, I think you mentioned that your staff was doing that. I know this has been a tool in trying to get hours to do that, since they can take it everywhere. Leslie, how's it been going for you?
Yeah, this has been attempting to be the practice for years. I mean, I think that's the goal, is to be able to bring clients in on their own treatment, and this allows it because, again, the staff have that information at their fingertips, and that they can pull that up at that moment and be like, is this still what we're working on? So it allows for that quick and
good.
Great. This one actually is for Dale. Can Dale talk more about how AI has helped his program overcome connectivity challenges?
Yes, the product is developed in a way that you do not have to be connected to the web to access the product. So being able to go in and where we are, and I'm sure this is in many places, just remote access or going into an environment that doesn't have Wi-Fi, we haven't been in a position to be able to do notes in the system. Now we're able to do that, and then it will reconnect and push the note out going forward.
And this last one is, does your AI technology interface with an existing EHR?
Yes. Yeah, so the AI product can be used separately from an EHR, but in our case, it directly talks to and communicates with our EHR, and so what's ever done in the product ends up in our EHR.
So this is
in real time.
Okay, thank you, Mary. This one's basically an add-on question that they're asking. What EHR are you using with Bells?
CT1.
And Dale?
We're using CT1 as well.
Okay.
Great. Well, great. It's basically that time, and we just want to thank everybody for joining us today for a very insightful session that's brought to you by Remarkable Health as well as Open Minds. As a reminder, all participants will receive an email in the next few days containing a link which will allow you to listen to the recording of today's presentation, as well as download a PDF copy of the slides. Thank you again and have a wonderful day. And thank you to our remarkable panelists as well as Monica. Have a great day.
Thank you. It's been a great session.